Good evening and welcome to our COVID-19 update. I'm Ladi Akiriduluale. Here are the highlights at this hour. National Association of Resident Doctors call off nationwide strike, say they will review progress of talks with the federal government in 2 weeks. Independent National Electoral Commission INEC says voters in Edo elections who fail to wear a face mask will not be allowed to vote. And United States Senate kills $300 billion COVID-19 aid bill. Some heartwarming news is what we begin with from the health sector, as the National Association of Resident Doctors has suspended its nationwide industrial action. The president of the body, Dr. Aliyu Sakomba, confirmed this to Channels Television in Abuja this evening. However, Dr. Sakomba says the union is to review progress made in talks with the federal government in 2 weeks. The two sides held lengthy negotiations yesterday at the office of the Minister of Labor and Productivity, Dr. Chris Ngige, after which the resident doctors team promised that it would be meeting with its National Executive Council with a view to calling off the strike, something it has now done. Only persons who test negative to COVID-19 would be allowed to fly into Nigeria. And that's according to the chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, who reiterated the protocols guiding travel into Nigeria and stressed the need for pre-boarding testing, with travelers advised to visit and register their information before any trip. Mr. Mustafa was speaking at today's Presidential Task Force briefing in Abuja. While apologizing for the hitches intending travelers had experienced trying to pay online for their COVID-19 tests, he also announced that an additional 8.9 billion naira has been approved by the president as funds for hazard allowances for health workers.
Over the past 1 week, I wish to reiterate that all travelers arriving in Nigeria must have tested negative for COVID-19 by PCR in country of departure, pre-boarding, and the PCR tests must have been done within 72 to 96 hours before departure. It is also important to note that passengers are required to remain in self-isolation upon arrival and undergo a mandatory COVID-19 test in a designated private laboratory by the 7th day after arrival. The Presidential Task Force is aware of and working with other partners to speedily resolve the teething challenges faced by intending travelers in accessing the portal, the cost of the test on arrival, inability to complete payment online, and consequential inability to board. We therefore apologize to everyone that had experienced these challenges using the platform. We assure all Nigerians and visitors to Nigeria that the PTF is working across multi-layer stakeholder platforms to ease the bottleneck. Over the past 1 week, a lot of discussion in the public space has happened around the strike action by doctors and threat by other unions in the health sector. While appreciable progress has been made in the negotiations to resolve the issues, I must underscore the fact that we are in a global public health emergency situation that has impacted negatively on all aspects of our lives, including the economy and finances of government. This has made it imperative for all citizens, irrespective of their professions, and particularly health workers, to reawaken the sense of humanity and patriotism. The health survival of our dear nation is important, and we should eschew any action that will diminish the gains made in the containment of the pandemic so far. I'm pleased to announce that Mr. President has graciously approved additional 8.9 billion naira for COVID-19 hazard allowance to all medical and health workers in the country. In addition, The procurement of personal protective equipment, PPE, for hospitals and isolation centers is in progress and will be given priority.
The chairman of the Presidential Task Force on COVID-19, Boss Mustafa. As some state authorities prepare to reopen schools, the PTF has been speaking as well on the role of students in the safe reopening of schools. According to the national coordinator, Dr. Sanya Liu, they will be requiring two things from state officials. The first will be to conduct a risk assessment for all schools, and second, to ensure that measures are put in place for schools to reopen safely in strict compliance to national and state guidelines. Dr. Liu also enumerated the roles students are expected to play to keep numbers from rising.
There's no doubt COVID-19 is still a significant threat to us all and cannot be ignored as schools plan to open. Other than an effective lockdown, it's been shown consistently that school closure is one of the most effective ways of dealing with the COVID pandemic. It definitely, almost certainly, poses a greater risk to the health and safety of the parents and the grandparents more than that of the students, and maybe to a lesser extent to the teachers, especially if they are of advanced age. We are appealing to students, parents, and school officials to continue to take precautionary measures that can change the current position of young people as high transmitters and turn them into champions of behavior change in the sphere of influence. While governments are ensuring institutions take the necessary action to safeguard health, safety, and security of students across the country, students, on the other hand, also have responsibilities. These responsibilities include the non-pharmaceutical interventions that we have mentioned over and over again. They must ensure physical distancing, stay 2 meters apart within classrooms, dining halls, hallways, adhere to alternate attendance arrangements. This is a difficult period for all of us. It's not a normal period. Class attendance will most likely be different from what it used to be. So therefore, students need to comply with any change in the arrangement in terms of attendance to classes or splitting of classes, etc. For our young, we know that they have peers and they have schoolmates that they haven't seen for a long time, and we urge them to socialize with them with great caution. We are also asking parents to please explain these life-saving guidelines to their children. Ensure that your children have masks. Ensure they have access to hand sanitizers. Ensure that they maintain physical distances and they understand the importance of these measures. Importantly, ensure that they wash their hands thoroughly and safely dispose used masks upon returning home.
The Independent National Electoral Commission, INEC, has announced that any voter who fails to wear a face mask will not be allowed to vote in the coming Edo and Ondo governorship elections. INEC Chairman Professor Mahmood Yakubu at the Presidential Task Force briefing in Abuja today said there will be strict compliance with health guidelines during the polls in both states.
It is mandatory for every voter to wear the face mask or face covering, without which the voter will not be allowed to vote. We need to emphasize that we are not asking for the kind of face mask I'm wearing, not surgical face mask, but face covering. Face covering will be sufficient for the voter to be accredited and to vote. Voters must avoid touching surfaces or leaning on walls at polling units. Furthermore, we also have clear protocols for dealing with voters who show symptoms such as high temperature, cough, sneezing, etc. In this case, they must obey all directions by officials to stop other voters from getting infected.
The people of Shaki and nearby towns in the Okeogun axis of Oyo State have a new health facility to cater to their needs. The hospital was flagged off as an infectious disease center by the previous administration in the state, but the uncompleted structure has now been remodeled and renamed the Shaki Specialist Hospital to complement existing healthcare facilities in the state. Its upgrade was done bearing in mind the COVID-19 pandemic, but it's also expected to offer specialized services to different groups of people, especially the aged population.
When the coronavirus broke out in Nigeria early in the year, one of the highlights was how it drew attention to the poor state of health infrastructure across the country. Addressing this challenge, the Oyo State government is converting one of its 2 infectious disease centers to a specialist hospital. This, according to the governor, is to complement existing health facilities. This event at Shaki is the official commissioning of the remodeled and upgraded project abandoned by a previous administration. It now houses the state's 2nd infectious disease center. The facility is now converted as a Shaki Specialist Hospital.
When we took over office last year, our healthcare system was not in the best shape. At the onset of COVID-19 pandemic, we had to make tough decisions to leverage on the situation and accelerate our plans to address the dilapidating healthcare infrastructure in Oyo State.
Among other things, the facility is expected to cater to senior citizens.
This structure today is a security for our elderly time, for our good health, both now and into the future of our elderly life.
Governor Makinde sees this 100-bed facility as one of his legacy projects. He's promising to build 351 model primary health care centers across the state. This, to him, is to revolutionize the state health sector.
We've invested close to ₦500 million on this facility, and for equipment alone, we've invested over ₦250 million.
The upgraded hospital is equipped with a 10-bed intensive care unit with 2 gradient state-of-the-art mechanical ventilators, among other modern medical facilities. Bukola Oriowo, Channels Television News.
Let's talk to Professor Charles Tobin West, Professor of Public Health, College of Health Sciences at the University of Port Harcourt in Rivers State. Thank you for your time, Professor Tobin West, this evening.
Thank you for having me. Thank you very much.
Let's take a look at some of the things that have happened in terms of protocols and developments on the COVID-19 fight first. The issue of schools resumption, this has been extremely controversial because of the peculiar nature of the children that one is dealing with, and then, of course, the issue of facilities in the schools. From what you heard today from the Presidential Task Force about what is going to be required of every school before it is allowed to open, are you a lot more confident now that we are taking the safe road?
Oh, yeah, I think if we put those measures in place, I think we could reopen our schools. Of course, with caution. And it's been made clear that teachers have a lot of role to play, the parents have a lot of role to play, the students also have to understand that it's not business as usual. And so if we synergize these together, I think we are good to go. One thing we have to understand is that it's also hurting the children if we keep them at home for this long. And a lot of parents are already very apprehensive, are very concerned about children being at home. If you watch, people are getting back to their normal ways. And so I think if we put these measures in place, we make sure that there is social distancing, we make sure that they imbibe the culture of their washing their hands as regularly as as required, putting on face masks and the rest of them, with, of course, intensive monitoring, I think we can safely reopen schools.
Let me talk about the tertiary institutions in particular. I mean, you are in a tertiary institution, in this case, the University of Port Harcourt. There are those who will say it is easier to open tertiary institutions because in that case, you are talking about young adults who already are familiar with these protocols and may find it easier to obey them. But the issue of facilities may be a problem, isn't it?
Well, I think I go by that school of thought that believes that the students in tertiary institutions understand the implications better than the very young ones in the primary schools, that the very young ones in the primary school might not understand the implication of this virus, contracting the virus. And so it just takes the various managements to put those measures in place that will require safe participation in learning. You know, I think if that is done, if we can provide enough spacing, or maybe rescheduling of lectures at better, more auspicious times and things like that, providing the necessary hand washing facilities, hand sanitizers, ensuring that every student puts on mask and all that, then we can reopen schools. We need to understand that we are likely to hurt ourselves the more we shut down everything because of COVID-19. So come to think of it, recent times we've seen a lot of campaigns going on for states where electioneering campaigns and the rest of them. If those are going on, why can't schools be reopened? So I think we need to observe some caution, actually. Not saying that we just go on and, reopen schools without putting the necessary measures in place. I think we can safely reopen our schools, ensuring that the necessary measures are put in place. I think that's my opinion.
You touched on the issue of elections, and that was going to be my next point, because that's something else that was talked about. The INEC chairman was at today's task force briefing, and he talked about no face covering, no vote, as well as other things that would happen in the Edo and Ondo elections. Are you satisfied that that would create a conducive environment where COVID-19 may not spread, given the antecedent of what has happened in the campaigns that you made reference to earlier on, a situation where the campaigns we saw by virtually every party, no social distancing, many not wearing masks and so on. Are you confident that with what INEC says it has done, we can safely go and do these elections?
Yeah, first and foremost, we must understand that I heard about the face mask, face covering and all that. If we look at the whole, the preventive measure, we understand that the face mask is like a top-up. We need to emphasize social distancing. That is paramount. We need to emphasize hand washing. So the closeness is also very important. There is no definite proof that COVID-19 is airborne. It's a droplet infection, and for that reason, social distancing, at least 1 to 2 meters, is sufficient. So if people have face masks and are still clumping together, if they don't wash their hands and all that, I think the risk might still be there. So face mask good, but others should go along with the face mask. If there's a way voters can be positioned in such a way that there's some space of that one, at least 1 meter, minimum of 1 meter, at least minimum, not less than a meter, then I think they can go on.
The COVID-19 vaccine has been presented as possibly the best solution to this issue of the COVID-19 pandemic. But it does appear that largely Africa and Nigeria have been left out of the preparations and the production and the research going on into these vaccines, even the trials that are ongoing, Nigeria seems to be largely left out. I know we can spend a lot of time arguing as to why that is the case, but I guess the question I wanted to start by asking you in this segment is, what do you make about the global fight to produce vaccines and what each country and continent is trying to do for themselves?
Thank you very much. Well, the race to vaccine is quite understandable. It's understandable in the sense that COVID-19 is a new virus and it came with some devastating effects, and a lot of lives lost, economies destroyed, and the rest of them. So the things countries are doing to make it now is to ensure that there's a vaccine. At least with the vaccines, it will reduce the mortality, that number of persons that will contract the virus and the persons that will lose their lives from the virus. It will also instill confidence and people can go back to work. The economies will be restarted, become productive once more, lives become better. And in the process, companies and countries will make money also. So it's a global competition. The Russian vaccine, after stage 2 trial, has showed some very reasonable promises, but it's not concluded yet. There's still more trials on. Then the Oxford University vaccine with Zeneca and had some setback, but I'm sure they're going to work on that. And there are still other countries and companies that are working on vaccines. I don't think Nigeria is left out. I want you to understand that nobody does it for you. I think scientists in their own ways are also doing their bit, like the Redeemers University, they are all trying, other places too. But it's just that they've not come to this level where these others are. And so it will not be completely true to say we are left out. The issue of trials, it will not be too good for you to develop it somewhere in Russia and come and try it out on us and things like that. Before we accept the vaccine, we must ensure that safety measures are all put in place, and it has some very reasonable safety measures and things like that. So I think we are not completely left out. We are global players too, and so I think we're on course.
Okay, but as you say that, Prof, what comes to mind is the fact that, yes, they say race, but some people appear to be better prepared for this race. Let me give you an example. Australia, the United States, the United Kingdom, and others have already placed orders well in advance. They've paid money to some of these companies that are producing these vaccines so that they get first shot at the vaccines when they are ready. That's what I meant when I said it appears as if we are being left behind. And we have been told that Nigeria doesn't really have the money to make such huge investments in this at this point, given the state of our economy. So the next question, I guess, is, can we afford to do this? I mean, even when the vaccines are ready, can we afford to pay? Can we afford to buy them? And how many would we need for our own population?
Well, I think that will be left for the operators of our economy to look at the strength of our economy, the strength of and see how much we can be able to put in that wise. Vaccines are usually actually not cheap. People pay for them, even the ones we get for free, people pay for them. And I believe the government, I believe they are sensitive enough to understand that the citizenry requires those vaccines, and I strongly believe that they cannot just keep quiet and see others have it, and while we don't have that. I don't believe that.
Let me ask you about facilities now. When this pandemic first hit in Nigeria, the report we took just before we started this discussion with you was about a hospital being commissioned in Oyo State. In the aftermath of the pandemic, a lot of states and the federal government ramped up their spending on health facilities. Many built isolation centers, revamped teaching hospitals, and so on, to try to cope with COVID-19. But it does appear as if those facilities now are falling into disuse in many states because they are not being used. What would you say those facilities should now be turned to used for in the aftermath of the pandemic stage of this thing?
Well, it is true because, the COVID-19 came up with a lot of apprehension, and every government, every state, everybody was, expected to do something, and each and every one of them did. And, we know that there are declines in the numbers now, quite all right, but that does not completely suggest that maybe that the epidemic is flattening, that the curve is flattening. No. One, if you watch at people's behavior, you'll find out that a lot of people are no longer putting on, for instance, masks, social distancing neglected, and a lot of our people have gone back to their normal ways, and people are not testing as, the apprehension is not as it were at the inception. And so people are not too bothered. Some have found that, there could be some other alternative ways to take care of the virus and things like that. And a lot of persons have seen that there is not a death sentence after all. And so the rush to test has declined, but that doesn't mean that the curve is flattened completely. It's a risk involved because it could rebound in such a way that we run into those centers. However, for those temporary sites, made of tarpaulin and all that, I don't think maybe the governments would think of other uses for them. But it is always good to get the health sector in readiness for any eventualities like these. I know it took the country, not only Nigeria, several other countries unaware. Several European countries could not cope. I can even remember countries like Italy getting doctors from Cuba and the rest of them, asking for help. So Nigeria was not the only country that was taken by surprise. It was just the nature of the virus and the way the bang came. And so what lesson it tells us here is that we should always put our health sector in the proper shape all the time. We do not need to wait for such exigencies before we become reactionary in trying to put this and put that together. We should be up and be more proactive in taking care of the health of our people, because health is a very huge resource. Without human health, the economy cannot be productive in any way. And so I think that's what I can say for now.
In terms of, and this will be my final point on this discussion. In terms of putting the health sector in shape, one of the things that also had happened is that the issue of welfare of the personnel in the health sector had come into sharp focus. The resident doctors are calling off their indefinite strike action this evening. Everybody expects them to be back at work tomorrow. But there are still issues in terms of welfare of those who are at the front line of fighting the various things that are going on in the health sector. Do you have any thoughts on how that can be put in the plans going forward for the future and strengthening the health sector?
I think the issues, if you ask me on that regard, is just one. The government agreed to give some COVID-19 specific type of allowance Nigerian government is not the only government that gave or promised that to its healthcare workers. Several other countries did, and because a lot of risk involved, a lot of commitment is involved, and the rest of them. And when the government is now not going along with these promises, and I think that is where the fight with the misunderstanding with the resident doctors came in. And but from what we've gotten to see today, that the matters are resolved, and the doctors have called on the strike, and I congratulate them for that. And so I believe the federal government will also commence the process of meeting, ensuring that those promises that are made are fulfilled. And so I think that will not be any problem at all. Yeah.
All right, then. Thank you so very much, Professor Charles Tobin West, for your time on the program this evening.
Thank you for having me. Good night.
176 new COVID-19 cases and 3 deaths have been confirmed within the last 24 hours in 17 states by the Nigeria Center for Disease Control, the NCDC. The figures show that the Federal Capital Territory topped the list of daily COVID-19 cases with 40 new infections, followed by Lagos with 34, Plateau 26, Enugu 14, Delta and Ogun had 12, Ondo had 9, Oyo 8, Ekiti 6, and Ebonyi 4. Others were Adamawa with 2, same with Nasarawa and Kwara, as well as Rivers. Edo, Osun, and Bauchi had 1 each. The 3 deaths were recorded in the FCT, Ogun, and River State with 1 each. Also in the last 24 hours, 276 people recovered from the virus and were discharged in 10 states, plus the FCT. Benue recorded the highest number of discharged patients at 110. Plateau discharged 70, Ondo 42, Delta 13, same with the FCT. Rivers 12, Ogun 9, Bauchi, Bayelsa, and Osun 2 each, and Ekiti 1. Nigeria's total confirmed COVID-19 cases stand at 55,632. The number of recoveries is at 43,610, and 1,070 deaths have been recorded in 36 states and the Federal Capital Territory. The NCDC in a tweet adds that, quote, a majority of COVID-19 cases in Nigeria are recorded amongst the 31 to 40 age group, while the ages 50 and above account for the majority of the fatalities. The agency is asking that Nigerians take responsibility and that this goes beyond protecting oneself, but also the vulnerable population as well. Jigawa State officially believes the COVID-19 pandemic has negatively impacted nutritional activities as the Centers for the Management of Acute Malnutrition in the state are becoming more congested. The Commissioner of Women Affairs, Hajiat Tati Ringim, disclosed this when she visited one of the centers responsible for the management of acute malnutrition. According to her, the state government had to suspend empowerment activities for women as a result of the pandemic.
Social distancing and wearing of face masks is rarely observed by these mothers whose main concern is to get treatment for their malnourished children. The state government offers free treatment for children suffering from malnutrition, although COVID-19 pandemic has become a stumbling block for some of these activities.
Apart from the pandemic, there are some other factors that are responsible. We are having the upsurge from other local government areas, including even some outside from the state. So there are a lot of factors responsible for that large turnout. We have a lot of neighboring local government, like for instance, all the crowd we saw in Sankara, they are not limited to Sankara or Bichi and Ringi local government. They are from other neighboring LGAs and even from our neighboring state.
Been empowering them, most especially widows with children. We've been doing that, but because of this pandemic, we've stopped our activities. But since the pandemic has gone down now, we will start, inshallah, and we'll empower them so that they can take care of themselves and their children.
The United Nations International Children's Education Fund reports that in every 10 children, 5 are stunted as a result of severe acute malnutrition in Jigawa State. The mothers are, however, glad that activities are gradually returning to normal and their children would get the necessary attention. Jigawa State, being an agrarian state, has the potential to produce various malnutritional supplements to fight the menace of severe acute malnutrition that is ravaging the state. Experts say with more effort from relevant authorities, there will be light at the end of the tunnel.
At the end of July 2020, the Kwara State government issued a warning that it would arrest and prosecute anyone not wearing a face mask in public places. 2 months down the line, the directive seems not to have been adhered to, as most people in markets and motor parks do not observe the COVID-19 protocols in Ilorin, the state capital.
The time has come for everyone to take full responsibility and act more responsibly as we confront this pandemic. Consequently, effective this Friday, 24th July 2020, nobody will be allowed into any public building, markets, malls, transport, banks, and so on, without their proper use of the face mask as a safety measure to lessen the transmission of the virus.
The spokesperson of the Kwara State COVID-19 Committee 2 months ago announcing the resolution of the government to start arresting and persecuting those not adhering to the COVID-19 protocols.
Thenceforth, anyone seen outside without proper use of the face mask will be arrested, prosecuted in a mobile court, and taken to any of our quarantine centers.
2 months after, the major market in Ilorin seems not to be bothered about the need to observe the protocols, as most of the buyers and sellers are going about their businesses without observance.
Maybe people didn't believe there is coronavirus, because I can see everybody here in the Kwata market, very few. It's very few of people that are using it. And I don't know, I can't really say the reason why they didn't use it.
The situation is the same at motor parks in Maraba Park, as the people seem oblivious to the directive and penalty. This traveller attributes the non-compliance to the safety protocols to general belief that a pandemic is over and urged for stiffer implementation.
Most of our people believe that the pandemic is over, and so we can continue to live our normal lives. Some are just tired of using it because, it's alien to us.
The police public relations officer, while reacting, says the police has been trying its best to implement by arresting offenders but limited with capacities which are not enough. As of now, there is no cure for COVID-19. Health experts are urging everyone to observe the non-hygiene safety measures like wearing face masks, washing of hands, and observing social distance when interacting with one another.
Meanwhile, as part of efforts aimed at mitigating community spread of COVID-19 and other diseases affecting communities, the Adamawa State government has commenced the recruitment of over 1,000 technical health workers in the state. This recruitment exercise, according to the chairman of the State Primary Healthcare Development Agency, is necessary because of providing healthcare to the doorsteps of the people.
Call it a major strategic move aimed at curbing the spread of COVID-19, and you may not be wrong. The idea of healthcare delivery to the ordinary people at the rural communities is a big priority for the Adamawa State government, and it says it's determined to make this work. As a first step, the state is recruiting thousands of healthcare workers to fill in the existing positions in the rural areas where community transmission of COVID-19 has become a big threat.
Obviously, there are evidence of community transmission. We have cases which we cannot identify their source or how they contracted the infection. So at community level here, because of our spread, our reach, and in view of the existing structure or the platform that we have at communities, in every of our facility, we have a facility management within the facility comprising of technical health workers, and they interface with the community.
At the headquarters of the Adamawa State Primary Healthcare Development Agency in Yola, the state capital, hundreds of healthcare workers turn out for the recruitment exercise. The senior special assistant to the Adamawa State Governor on Primary Healthcare Services says it's a strategy towards increasing the availability of the workforce in health facilities across the state.
Most of our staffs in the past have been ad hoc staffs of either one NGO or the other. So now these are the time that these people are winding down the services. And you can see that we're in a global COVID pandemic where our health system are being challenged. So now we're in a situation that we need to own up to our responsibilities. We have over 1,000 primary healthcare services, but right now we have just about 403 who are working within the states. And we're trying to break them down to 226. We're prioritizing quality against quantity.
A community leader in an area affected by insurgency describes the recruitment as a good development.
The governor and his team are doing well in controlling the COVID-19 spread. And by employing these workers also, it will go a long way.
According to the chairman of the Adamawa State Primary Healthcare Development Agency, the workers will be distributed equally across the 21 local government areas of the state to help in the fight against COVID-19 and take care of other health needs of the people.
Outside our shores, the United States Senate has shut down a $300 billion COVID-19 aid bill written by the Senate Republican leadership as Democrats blocked the measure on a procedural vote. The Senate voted 52 to 47 to advance the bill, well short of the 60 votes needed to continue debate on the measure. The vote comes as the U.S. Centers for Disease Control and Prevention said the number of deaths due to COVID-19 had risen by 1,115 to 190,262 and reported 32,899 new cases in the past 24 hours. Here are the other developments in our COVID-19 Global Update.
British Prime Minister Boris Johnson has announced a moonshot plan for COVID-free passports that would allow people who test negative to return to normal life. The plan involves mass testing with results returned within about 20 minutes, a negative result allowing entry to venues such as theatres and football stadiums, among others. However, medical experts have raised doubts about the plan, citing issues with laboratory capacity for current tests. Despite the fact that clinical trials have been suspended, drugs giant AstraZeneca says a COVID-19 vaccine could still be available by the end of this year or early next year.
If the vaccine works, we will know that in the next few months. The next question will be for how long? Are you protected for 3 months, which is useful but not very useful, of course? Are you protected for 12 months? Are you protected for 2 years or more? And this answer will only come as the trials continue. It will take time to give this final answer. Now, as to the first question, which is, does it protect people, at least for a period of time? We should know that before the end of the year.
The British company suspended late-stage trials this week after a participant in Britain reportedly suffered symptoms associated with transverse myelitis, a rare spinal inflammatory disorder. Meanwhile, United Nations Secretary-General Antonio Guterres has called for $35 billion more, including $15 billion in the next 3 months, for the World Health Organization's ACT Accelerator program to back vaccines, treatments, and diagnostics against COVID-19.
That's our COVID-19 update for tonight. Do go to our website, channelstv.com, to take a look at details of the stories you've heard tonight and indeed other updates on other stories from around the world. I'm Ladia Keridoluale. Good night.